Welcome back, everyone. After hours here on the Big Talker FM. We have a special guest in studio, Michael Lee, who's running for 9th District State Senate seat here in North Carolina. And before we left, we were talking about the economy. And here's something that's kind of related to the economy. That's healthcare, which I know is a huge issue around the nation, especially North Carolina.
Yeah, it is a huge issue. It's not just an issue for access and affordability of healthcare. It's a huge issue for business because providing healthcare providing healthcare benefits to employees is significant for small businesses and all businesses. It should be an issue also for employees because when your employer, when they're looking at how much they're going to pay an employee, they're looking at the net cost. And net cost includes benefits. So if they're paying $300 more for their health insurance, that's going to be figured into the net cost of that employee. If they're not paying for that $300, a lot of employers would rather pay that money since they're budgeting for the net cost to go to the employee. So everybody really wins as we bring down the cost of health care. There are a lot of ways we can do that in North Carolina. Y'all probably know here that in North Carolina we have a significant amount of mandates. And that's where the government says you have to have certain types of coverage on your health insurance policies. Well, that drives up the cost of health care. You're forced to have a Cadillac when you know what a Ford might do. And you may not want to drive that Cadillac, or you may not be able to afford a Cadillac and you don't want the option to be I get the Cadillac or I got to walk. Yeah. So you want to have the option to buy the Ford. And if you can reduce the government-imposed mandates, and in this study I was talking about from the Small Business and Entrepreneurial Council, they talk about some of those things and the impact on small business and the additional cost of small business that's derived from the mandates from state government. North Carolina, again, ranks very high up in the United States in the number of mandates that we have. Another issue with healthcare costs is tort reform. And there are different kinds of tort reform, but I'm going to talk about medical malpractice tort reform in North Carolina, or the absence of it. We don't have it. And if you look at other states like Texas and some of the other states who have implemented tort reform, which is not just capping non-economic damages, it's a whole series of mechanisms in order to bring down the cost of health care, lessen the exposure to frivolous lawsuits from a malpractice context. What those things do, especially the cap on non-economic damages, is it reduces the what some physicians call defensive medicine. Mm-hmm. They will know that they're going to have to answer to a lawyer at some point in the future. So what they're doing is they're saying, well, I know they probably don't need that test, but what's a lawyer going to say in a courtroom 2 months from now? Let's go ahead and get that MRI. Let's go ahead and get that CAT scan. Yeah. And what that does is it increases the cost of health care. It increases the cost because a lot of those tests are incredibly expensive. The machines are expensive. That goes into your health insurance policies. And what you see in those states that have incorporated tort reform is there is not that significant amount of defensive medicine.
And plus, what I love about tort reform is it costs taxpayers nothing.
Costs them nothing. It saves money, increases affordability and accessibility of health insurance to all populations. It reduces the cost to business. We right now need to be looking at jobs and the economy in addition to health care, and that is a significant cost where we can help our small businesses and large businesses.
I was just going to say, the malpractice insurance, it would definitely lower those rates for doctors. So, I read so many articles about doctors who are retiring that are good doctors, and they're retiring because they've made their money and they don't have to practice, but they like doing what they're doing and they're good at it, but they're not doing it anymore just because of the risk of lawsuits.
Yeah, and you've got a strong lobby that is opposed to tort reform. I mean, you've got the Trial Attorneys Association. They even produce, and I think I brought it here with me, they even produce something called medical negligence, a primer for the nation's healthcare debate, because they anticipated tort reform was going to be a huge debate when we came down to healthcare. But, the Republicans keep trying to talk about it, but nobody else is really discussing it. And, in this report it says, there's no real evidence that defensive medicine exists. Well, that's just ridiculous. You can ask any physician, any medical care professional about defensive medicine, and they're going to tell you. I was meeting with a doctor the other night, and he said, I'm a good doctor. I know when my patient needs an MRI. But what I have to think like a lawyer. I have to think, well, what if someone wants to second guess my decision, a month from now or 2 months from now, even though I made the best decision for my patient? What ends up happening, this is a very slippery slope here, when physicians start to engage in defensive medicine, that physician says, okay, this set of symptoms, he probably doesn't need the MRI, but I'm going to do it anyway because I'm worried about getting sued. All the physicians engage in that, and it creates what's called a standard of care. So that if you're a physician and you say they don't need that MRI, that cost is not needed, and you don't do it, all of a sudden there's this standard of care that all the other doctors are doing it that you get measured against when you get into a lawsuit. So it's a very, it's kind of like a cat chasing the tail kind of thing, and it gets worse and worse. So we really need tort reform in North Carolina. It's been talked about. They capped punitive damages in North Carolina, which is the damages in a lawsuit that they use to punish someone because they've just done some bad stuff, and the only way they know to do it is in their pocketbook. Yeah. But they capped that at $250,000. So what they do in the courtroom now is they use the non-economic damages, and non-economic is pain and suffering, loss of consortium, infliction of emotional distress. They use that as a way to get around the punitive damage cap because they say this guy or this lady was so bad that, this was so horrible, I need $1 billion because they had that much pain and suffering.
Well, I was just going to say, it's funny because a lot of people on the left will talk about socialized medicine over in Europe. And Europe actually has a 3-panel of doctors, and when you try and sue a doctor over there, these doctors come together and they look and they see if there's any negligence. If it's not there, you can't even take it to court. And it's just funny that they have socialized medicine. They understand that's what you have to do if you want to provide health care for everybody. Yeah. You can't have frivolous lawsuits. And yet you don't hear the left talking about how great that part of Europe's socialized medicine is.
Yeah, and I honestly think people do need a redress in the courts for negligence, whether it's medical malpractice or someone who's been negligent driving a vehicle. But we need to have reasonable regulation in place to prevent abuse of the system, because that's what we've got right now, a lot of abuse of the system.
Right. I think it always goes back to that the McDonald's hot coffee incident, where it's like, how many times can somebody knock coffee on themselves and it's somebody else's fault? But then if the drive-through person drops the coffee on you, then that would be their part. But I think we start to muddy what's important and what's actually legitimate.
And tort reform isn't just a cap of non-economic damages. There are other things that come into play. You can have mandatory arbitration so that you can get into an arbitration, or mandatory arbitration, non-binding arbitration. So you go through this arbitration process where you may have, 3 medical professionals, you may have 3 lawyers, but you arbitrate it, you get it out there, and you look at it before you get into the court system. Before you file that complaint, you start taking depositions because the North Carolina Bar Association, I think they have something like 95% of the costs can be saved through arbitration as opposed to actually getting into litigation. Just taking that extra step, getting people around the table, analyzing it, looking at it before you get into that process of a lawsuit can save a lot of time and money.
Yeah, definitely. And we got about 2 minutes left. So I was going to ask about education real quick. And I liked your plan you have on your website. Though.
I can fix it in 2 minutes. I was reading an article by Jim Mamsey, and he was talking about the nation as a whole. Mm-hmm. We need to deregulate our government school systems. And not a lot of people are talking about that. And they look at me and they're like, what are you talking about? But we need to decentralize it. We need to make it more entrepreneurial, and we need to have a system where funding follows students instead of going to schools. It's almost like a charter school concept on steroids. There are other states that are doing it. There are other states that are allowing public schools that meet certain standards to opt out of the government system and into a charter school system. There are a lot of ways that we can do that here in North Carolina. Imagine this. If we had in North Carolina or in New Hanover County, we had a charter school that focused just on at-risk kids. We're losing a third of our kids that don't graduate on time. Think what we could do with those kids if we had a charter school focused on gifted children or one focused on math and science. And the charter schools in Brunswick County, the Roger Bacon Academy, does a great job. They focus more on the behavioral aspects of education. And I was talking to a parent about what a great job they do. And one of the parents said to me, I really don't like the way they do that. It's not the best for my kid. Well, the great thing is about a charter school concept is parents have the choice. They don't have to go there. You can take your child out of that school, put them in another school that fits them better, and the funding is going to follow that student. What that does, it creates an educational marketplace where the levels are going to get higher. And I know you can't see my hands move because we're on the radio, but that's what my hands are doing right now.
Exactly. Unfortunately, we are at time. I do want to thank you for coming on.
Yeah, I appreciate it.
Joining us, Michael Liu. And we'll definitely have you back as the time progresses on. You're listening to Right on Campus After Hours here on The Big Talker.